Hello and welcome. My name is Bridget Wallace. I'm a physical therapist and owner of 360 Balance and Dizziness located here in Austin, Texas. So welcome to our Let's Talk Vestibular educational series. We had this idea to do this kind of collaborative effort where we connect patients with a variety of different healthcare providers or other resources for those who might be affected by dizziness and or a balance disorder. And I'm super excited to kick this off with Dr. LaMour. He's a podiatrist with 20 plus years experience here in the Austin, Texas area, and has a couple of clinics, one central north Austin off of Shoal Creek and around Steck, and another practice in Pflugerville. And for those of you that have attended this live, you may notice that I'm in the same place, but I'm dressed differently, and that's because we had some technical issues with the recording of the initial video. So as you see me fade out and we pick up where I was interviewing Dr. LaMour, you may still hear a little bit of echo, a little screechy in the audio, but what I had done is I'd done a brief introduction of him, and then I was curious of how he chose to become a podiatrist. And I had asked him, did you decide, in medical school? Did you already know before medical school? And he was sharing an experience where he knew he wanted to go into medicine, and he did rotation in a podiatry clinic and just loved it. He thought it was a very underserved area. It was a very niche market, and he began to have an interest in foot and ankle dysfunction and treatment options early on, and of course peripheral neuropathy being one of those, which is the topic of today's discussion. So I'll fade out and you'll hear him pick up where he's talking about his experience of why he went into podiatry. And again, thank you for your participation, and please stay tuned for future vestibular talks that we'll do.
The tendency right now, what I'm seeing with a lot of my colleagues, you're starting to see more and more specialization, even in the field of orthopedics, where there's guys that are just doing upper extremity or lower extremity or focusing on different things. But podiatry, we do foot and ankle in the state of Texas. Everything from ingrown toenails to rashes to fractures to sprains and strains. I myself do a lot of diabetic just maintenance stuff, as well as limb salvage and infections. The diabetes is what kind of led into the neuropathy and my interest in neuropathy, which is kind of something we're going to be talking about today. But that's and a lot of people think podiatrists they're working on a corn on my toe. Well, yes, we do a lot of simple stuff like that, but do a lot of surgery for bunions or hammer toes, and again, like I said, fractures and sprains and strains. So anything pretty much foot and ankle related would be something that we would deal with.
Well, and perfect time to kind of lead into this, since today's topic is about not just peripheral neuropathy, but the use of this gel for pain, for sensitivity, and even to improve function. And we learned about this product from a patient who had really good results from it. And so obviously, peripheral neuropathy is something we see a lot in patients, and it's a struggle not to have better resources, especially when the pain can be so disabling and affect balance. So anytime we can hear about something potentially helpful, we're looking to learn more about it. So tell us more about the gel, and I'm interested in how the product was even developed.
Yeah, I tried to find a picture of the first way that we initially did the treatment, and I could not come up with it. But I had a patient that was in my office that was having symptoms of neuropathy, and he had failed a lot of things, which is not uncommon by the time they get to me. And he was like, I'm just not happy with the treatments that are available. Now, this particular gentleman is a scientist by trade and made his living in nanotechnology. So anything that was small is his kind of thing. And so he's like, he started to do some research himself on some of the pathophysiology or the changes that occur with diabetic neuropathy. And he was not diabetic, but that's there's probably more literature about diabetic neuropathy than any of the other types. And one of the components of diabetic neuropathy is the nerves don't get enough oxygen. And we know this for a fact, and there's multiple reasons for this. And the smarter we get, the more we realize how complex it is. Because with diabetic neuropathy, there's not only changes in just the nerves in the feet, but there's changes in the spinal cord, there's changes in the brain. And so it's really quite complex. But again, to reiterate, we know for sure with diabetic neuropathy that the nerves aren't getting enough oxygen. So his thought process was, well, geez, if I could make oxygen into tiny bubbles and create some sort of solution or medium that they would be stable in, if we concentrate the oxygen high enough, it will diffuse just by physics. It will diffuse through the skin. And if it gets into the soft tissue, will it get to the peripheral nerves? And if it does, will it help? And so the first way we did the treatment is we had an oxygen tank hooked up to a machine that was a pump that was putting these bubbles into a warm water bath. And so you actually had the patients would sit in my office with their feet in a warm water bath, and we'd have these oxygen tanks and a small motor. And the key to it is to get the bubbles small enough. And so they designed a mechanism where you can make bubbles much, much smaller than your skin pores. And so therefore it can diffuse through the skin. And I'm a skeptic at heart about anything, but he is a patient, and he said, geez, he goes, would you try this if I could develop this? And so we tried it on a couple of patients. And again, I'm like, yeah, that's too simple. But, we had, 6 or 7 patients come in, and we were having patients were noticing improvement. And with the initial patients that we really took a look at, it was right around 40 patients. And this would have been, I don't know, several years ago now. And it was a variety of types of neuropathy. So we had your diabetic neuropathy, but we had several other types, and we had what is known as idiopathic neuropathy, which means they're neuropathic, but we don't know where it's coming from. And across this first 40 patients or so we did, it helped. It was helping 70% of the patients were getting some improvement. And, we were looking at on a pain scale, and the patients that were improving were on a pain scale of 1 to 10 were improving 6 points. And so if their pain was at the level of 8, we were getting these patients down to the level of 2. That's pretty significant. And so that drove me to stay with the treatment. And we've done multiple iterations of this treatment now. The way it works now is you get a box with packages of gel in them. You put a little plastic booty on the foot and ankle, and then you just pour this gel down into the booty and massage it into the skin and just let it sit there for 30 minutes. And so we've come a little, you don't have to come into my office and listen to this loud machine and sit in here for 30 minutes anymore. But the treatment, the protocols, I'll have a patient typically come in, and I will send them home with 5 treatments, and I want them to do 5 treatments over a 10-day period. And then they come back in and we reassess. Since we did that initial study, we just recently had a much larger or more detailed study that was published in Diabetes and Clinical Research. And so with a more detailed study, the treatment does work. It takes usually between 5 and 10 treatments to achieve your improvement. And then when we're treating patients from that point, we're treating them like once a month. So initially it's a little bit intensive. You've got to do 5 to 10 treatments that are 30 minutes in a short period of time. But after that, we're finding that most of the patients, if they do one 30-minute treatment every 4 weeks, give or take, and that seems to get them, that seems to maintain their improvement.
Okay, so just for clarity, let's say I have a 30-day, a month. Within that first month, someone would be.
So I like them if they're going to, if I was going to say ideally, I'd love to see somebody do 10 treatments over a 3-week period.
Okay.
Initially. And then, we're seeing somewhere between 60 and 70% of patients are improving. And then to maintain that improvement, you're looking at once every 4 weeks. I've got some patients that are doing one treatment every 6 or 8 weeks. I've got some patients that find that they go much longer than 3 weeks. The symptoms start to return. So they're doing it a little bit more frequently. The treatment, you're soaking your feet in nanobubbles, tiny bubbles of oxygen and carbon dioxide. So to me, the beautiful thing about the treatment is it's successful. It helps something we don't have a lot of great treatments for. And what are the risks and side effects? Well, you're soaking your feet in oxygen and carbon dioxide. We breathe these things in and out. So an adverse reaction I find would be, really unlikely.
And so any, I guess, contraindication, would that be like any open sore?
Yeah, so you don't want to, we don't want to treat patients with open sores. We always make sure the skin is intact. And it's an interesting question because ultimately, again, going to diabetes and diabetic neuropathy and then diabetic neuropathy with ulcerations, eventually we're hoping to be treating wounds with this. But for right now, if you have any openings in the skin or any breaks in the skin, we're not recommending that you use it. Although ultimately we'll probably be using it to actually help heal some problem wounds.
Yeah, I mean, it makes sense when you think of the use of hyperbaric chamber or those types of to increase oxygen for the wound. And is this, just correct me, this is or is not covered by insurance?
This is not. The only way that it will ever be covered by insurance is if a company like Smith and Nephew or a large pharmaceutical company comes along and buys it, because the millions of dollars it would take to get through an FDA study and then get it covered by insurance is problematic for the company of this size. Yeah. And so I don't know if that, like I said, the way I would hope that someday that somebody comes along like a Smith and Nephew and adds this to their wound care product line, because you could infuse antibiotics into this gel in the same way for infected wounds that are lacking blood flow and use it as a treatment, but they would have to buy it. And then, like I said, the amount of money to put this through some of these complicated trials, it's a lot.
And we've got a question here. Does it help with dry skin?
So anecdotally, I see patients, we start, typically these are patients that are diabetic. And so they have dry skin, they have cracked skin. And I'm seeing overall, I am seeing an improvement in the quality of the tissues in patients that are using this. And so I'm not promoting it for that. Anecdotally, I've seen that a lot of patients are just saying, my skin is a lot softer. It feels better. Yeah.
And having seen the gel, it does make sense that it would actually help with dry skin. Yeah. And you actually already addressed a question I was going to ask, is maintenance. And so it seems like people are kind of finding their own maintenance. And when you talk about an improvement, is it primarily, is that improvement primarily in pain, or is it helping with function?
That's a great question. And I'm glad that you asked that, because what's happening, and if you remember, initially I will tell patients to come back in after 10 days. And so they've done 5 treatments. And so some patients will come back in and says, my feet feel a lot better. It's definitely better. I'm not having as much pain and my feeling is better. Then some patients are like, no, it's definitely not working. And some patients are like, I'm not sure. But what we do before we send you out the door, we use there's a test that we use to touch the light touch, how much feeling you have in your feet. And there's 10 different places that we'll mark on a foot, and we'll use, and I'm sure you're familiar with the Semmes-Weinstein monofilament. So we'll do a monofilament test, and we try to find one that's a diameter where a patient will get, 4 or 5 out of 10 areas that we check, they're negative for. And then when they come back in at 10 days, we recheck those, because some patients will come in and say, it's not doing anything after 5 treatments. And I'm like, well, here, we just tested your sensation. You went from being able to detect a 2.0 gram monofilament in 5 places on each foot. Now you're sensing it in 8 or 9. And so when I see that, that's a great way to reassure a patient. Yeah, you may not be having the improvements in pain yet, but something's happening because you're having less numbness. Your sensations are improving. And so those patients, we recommend that they do another 5 treatments, and then we again reassess. And it's interesting because some patients, and I can't give you a scientific explanation for this, but some patients will come in and do 2 treatments, and they're like, my pain was burning and keeping me up at night, and I'm not having any pain now. And I don't know why it works so fast on some patients and some not. I've got a family that I treat that come in from Midland, and I've got the patient, he's an engineer, and he's like, I am, you got to show me the science. I don't believe in this. And I was treating him for something different that he was in the office for, but he has one of the worst cases of neuropathy, and we don't know where it is from on him. It's idiopathic. We're not sure of the cause. And I've been treating him for this for 20 years, and he takes narcotics for it. And I said, Kent, while you're here, why don't you go ahead and just soak. This was back in the first iteration where you're sitting actually in the water being infused with the machine. Can't just go ahead and try this. He goes, I said, you're here. You're over here from Midland. I said, just try this and see what happens. And he actually called me that afternoon. He says, Doc, he said, that's the first time in as long as I can remember, I'm not looking at my watch to see when I can take my next pain medication. He goes, I was outside in the yard working. I forgot to take it. And so we have seen some really neat success stories like that. And, if you get a patient off some narcotics using, a gel to soak their feet in, that's a pretty good success.
Yeah, that's a great story. And then we've got a comment here. I've heard that stimulation of the sole of the foot can help. Do you know anything about this? My neuropathy is new. I have no pain, but I'd like to reduce or eliminate it or decrease it.
Well, so if you're stimulating the bottom of the feet, could you hypothetically be helping that? I mean, if you're stimulating the bottom of the feet, you're probably increasing blood flow to the area. So if it's a blood flow issue or a lack of oxygen issue, you could make that leap. I've never treated somebody. I've never used that myself as a treatment, but there's no harm in it, obviously.
And then we actually have a total body vibration plate here, and that is the premises of the theoretical framework behind is that it increases blood flow. Mm-hmm. Is to have someone be on a vibration plate, but you do have to have it pretty consistently. Mm-hmm. Where you've talked about this. Well, I say aggressive treatment. It's just more frequently in those first 3 weeks, and then some people it seems like they can manage those and maintain those improvements over time. Where a vibration plate, the literature has shown great improvements, but it does require up to 10 minutes a day, mm-hmm. Pretty consistently. And when you stop that, we kind of see a reversal of those benefits. So, mm-hmm. It really has to, it's a pretty big investment to buy a vibration plate. And I have seen some new where they have the little vibration pads and shoes. And I know this was going to come to market, and then it was put on a hold. I don't know now, but that does. I thank you for Nan, for sharing that, because I have a question too for Dr. LaMour and using the microfilament test. Here, because of vibration, mm-hmm. is so related to balance. I would be curious if y'all have ever looked at checking yes. vibration as well as light touch to sharp versus sharp.
Yeah, if you look at the study that we did, we were checking vibration, we were checking light touch, they were checking temperature, and so we were checking a lot more parameters in the office. It's easy to check 10 places relatively efficiently. But like in our study, we went into, we talked about sensation, we talked about pain, we talked about, it was a lot more involved as far as what we were measuring.
And I think, just for our listeners, when Dr. LaMour mentions that, he said light touch and temperature and vibration, and those are 3 big tracks from your feet that send information to your brain. And so some of you may have pain, but you still have light touch and you still have vibration. Some of you don't have vibration, and really that loss of vibration is very related to balance. And so that's why, I certainly don't allude to there's a cure, but anything that could help improve vibration, obviously decrease pain, because that's affects quality of life, is just very promising. So if someone was interested, is this something they come and see you like for a visit?
You can get on the website for this. You can just order it yourself. I would love to see patients and kind of steer them and help them through this, but you don't have to come in. The website, you look up the website, and actually I believe now the research, the article that we had published, I think is on there now, and they're just redoing the website. And I need to, let me just see if I can pull it up here real quick. But the product is called Noxypure, Noxypure. And you can get information on the website. You can order it on the website. There's, and you don't have to be under a doctor's care. It's kind of nice. They've just recently reduced the price, the cost for everybody. So that's always a positive. It's never met with much resistance, patients like that. And so I think the price for 10 treatments now, or for 5 treatments, I think they just reduced it to, I think it's $69 or $70. It had been $100. And so I'm just looking.
And so
if you just type in Noxypure, you go to the PeriFX website and it comes right up.
Okay, we'll make sure we get that typed in into the chat so that y'all can see the website.
But you can order it on the website, and you can set it up where you can have it sent regularly, or you can just I would.
Okay, hold on one second. I'm going to type it into the website.
If you just, the website is perifex.com.
Yes. All right. That's it. Yeah. Yeah. Jesse's on the call. Jessica's going to type in the website. Yep. She already has. So hopefully you can see that there in the chat, the link to the website. And Dr. LaMour's practice is on Shoal Creek, between like Anderson and
Steck.
And Steck. And we can also put in a link to Dr. LaMour's website as well. Do any of y'all have any other questions before Dr. LaMour scampers away to start seeing patients again? You can type it in or you can unmute. So just to reiterate, this has the study, because it's been a few months. Thank you for sharing that study. Did it primarily look at diabetic neuropathy?
This one was, this was diabetic. Yeah, so it's in the International Journal of Diabetes and Clinical Research. So this was done just on diabetics. I've looked at some of the pathology of the other types of neuropathy, and to me, if I had neuropathy, this would be my first line of treatment, even if I did not know what's causing it. I hate taking pills. I'm in medicine, but I prescribe them all day. But if I can do something that's simple and safe like this, it's kind of a no-brainer. And I've had great success with a lot of the autoimmune disorders and neuropathies. So your rheumatoid arthritis patients, they seem to respond well to it. And with those patients, it's been interesting because it seems to be helping with some stiffness and mobility of the joints. And again, it's not just one patient. I've heard this again and again where, they'll say, Doc, I feel like I'm moving better. I can feel better, but my joints feel like they're moving better. They feel more flexible and I'm having less pain. So, and again, I don't have, I can't give you a scientific data as to why that's happening, but I've seen that, again, with some of these autoimmune types of arthritides. So I wouldn't be afraid to try it on something that's not diabetic in nature, because the original 40-some patients we did was a variety of issues. And, we pretty much across the board, we're seeing good success.
Well, good. I was happy to learn about the product. And then I guess as we wrap up, today, you kind of answered this in your last, this would be your kind of first go-to. Is there any other resources that you would have for any of our listeners, whether it be supplements, do orthotics help? And I guess that could be specific, everyone's going to be unique, but do you have any other kind of go-tos when it comes to loss of sensation and or pain in patients with peripheral neuropathy?
The pain is tough. I mean, there's medications when we're all, I mean, Neurontin, gabapentin, these types of medications, but they're not without their side effects. And a lot of the medications are just aimed at making the symptoms more manageable. So if we can do something, I mean, neuropathy, as Bridget will tell you, there's two big, components of this in my mind that stick out. One is the pain, and the pain can keep people from sleeping and functioning. So it's a huge quality of life issue. The other thing is if you can't feel what your feet are doing, you're tripping and falling. I mean, fractured hips, fractured shoulders, fractured femurs. It's a big deal to not be able to feel where your feet are. And so, my patients, I talk a lot about balance and gait, and I send a lot of patients to balance and gait therapy, and they're like, well, is it really going to help? I said, if we can teach you to be more safe and not fall. I mean, my mother, for instance, in the last 3 years, fallen 3 times and ended up with fractured vertebrae all 3 times. And so she's had, surgery for her back 3 times as a result of falling. And, if we can prevent some of these falling with balance and gait therapy for the balance and gait issues, and if we can do something with the pain, that's great. For the pain, like I said, I like the gel. There's a vitamin B complex called Metanex that I use a lot. It's a prescription, and I have good success with that. Again, it's a pretty safe medication. It would be something to if you're going to know if it's going to help you. It takes weeks to months to actually start to see some improvements. But again, it's been a safe drug, and that's Metanex. That's a medication that I use a lot for the pain. Some patients will do well with just something simple like a biofreeze. If the pain is keeping them up at night, that's an inexpensive approach to pain. I've used topical compounded medications, again, when we're talking about pain, to try to give patients relief so they can get sleep at night and function better. Orthotics, you're not going to get hurt with better shoes and better cushions. So I have some patients that will respond to treatments like that also.
And I think just to thank you for that. Those are great shares. Thank you for that. And I think one of the common, obviously people being referred here for balance retraining and with peripheral neuropathy, and we do, whether you come here or whether you go, work with a physical therapist that you already know, is often what we're doing when you have a loss of sensation, we can't bring that back. Hopefully there are treatments just to see any type of improved function with like the gel. That's why I really wanted to bring Dr. LaMour in. But it's like, how's your inner ear working? How's your vision working? What's your strength like? What's your range of motion like? But there is some reality potentially of limiting improvements in therapy, and it's not to be a negative Nelly, but when you have loss of sensation in your feet, it's really difficult to retrain balance. It doesn't mean therapy can't help. Again, it's wherever you choose to go. There's a lot of things we can teach people, but we can't bring the sensation back. And so it's still, a lot of people say, well, I feel better and I think I'm doing better, but I still feel like I'm walking on clouds, or I still don't trust my feet. And it's because that peripheral neuropathy is still that underlying issue. So I encourage you to seek help. And sometimes there are definitely some limiting components to improving your balance with peripheral neuropathy. All right, any questions around that? Okay, well, thank you all for joining. I really appreciate it. And if you want to type in or, any other topics of interest, we'll be doing these every month with different people in different disciplines. And so stay tuned. And thank you, Dr. LaMour. Thank you all for taking your time to be on today's vestibular talk.
Everybody stay safe. Thanks, Bridget.
All right. Happy New Year.
Thank you.
Bye-bye.
Bridget, is he in Pflugerville also?
I'm sorry, Saritha?
Is he in Pflugerville also?
Yes. Yeah, I've got an office in Pflugerville and one in Austin.
Okay.
Okay. So where's the one in Pflugerville?
It's on Heatherwild, right off of 18. What is it? Is it 1825? You know where the
Yes.
Yeah. I'm in a Seton facility there, so it's a multi-specialty.
Oh, yeah. Okay, yeah, know what you're talking about. Okay,
Okay.
Thanks, Aretha. Hi, Mr. Pence. Oh, there's another question. Will this be recording sent out? Yes, I have a little editing to do and then we'll make the video available. I appreciate you asking.
Bridget, can you hear me?
I can.
Can you hear me, Bridget?
I sure can.
This is Albert. I've got an echo because I don't know how to use Zoom very well. But I've seen
Do you happen to have it on two different devices?
I do.
I think that's why. If you mute your speakers on one device, you won't get the echo.
Okay, maybe that. Can you hear me now?
Yep, that's it.
Okay, I did it. I've got large fiber peripheral neuropathy, both feet, and I have no pain. Both feet are numb, and I have absolutely no balance. Will this treatment help, or do you know if I'm one of the few people that has no pain?
Yeah, and I think Dr. LaMour, he may still be on, but what he is finding is that there's not in the study, and I know you love studies. So I'll send you a copy of the study.
Please, you have my email address.
They did find some improvement in vibration, not just soft touch, and the microfilament test. So the study did focus a little bit more on pain, but they have looked at sensation, which did show an improvement. And I don't think we know, but if you can improve sensation to vibration, I think you have a better chance of improving balance.
I sure hope so. It has not improved. In fact, I think it's getting worse.
Yeah, it's when you don't feel vibration. So again, there's those three tracks. There's light touch, there's pain and temperature in one track, and then there's vibration. And when you have that loss of vibration, then even though your brain can process balance, it's not getting there. And so you just don't really know where your feet are. You don't know where you are in space. And then, having an inner ear type of issue on top of that is even more challenging. So making sure that the use of your inner ear is optimal, because we can typically, as long as your inner ear is sending messages to your brain, we can retrain that.
Thank you.
Thank you. It's good to see your face on here.
Oh, thank you.
All
do
right,
remember
well,
to send me that. You have my email address, or I'll send
I do. I still have your email address, so I'll send you the article. In fact, we'll make the article available for everyone. We'll just put a link to the video on our website and also the article.
Thank you very much.
All right. Thanks so much.
Bye-bye.
Bye-bye.